Hi guys, I'm Dr. Parissis and welcome to another video. I get a lot of young male patients asking me whether this means that they have male pattern baldness. The answer does depend on a few things. And the first thing is how coarse the patient's hair is. Coarseness of hair is different to hair density. Hair density is the number of hairs in a particular area of the scalp, but coarseness relates to each individual hair strand. Specifically, how thick is each individual hair strand. So you have more coarse hair when each individual hair strand is thicker. Those with finer hair, the scalp or the crown can be a little bit less forgiving and make it look like they are undergoing male pattern baldness when they are not actually. The second thing is the color of the hair. So patients with darker hair will have a greater skin to hair color contrast, which will highlight any kind of scalp skin that is seen, and again be a little bit less forgiving with the crown. Make it possibly look like they're undergoing balding, but they aren't necessarily. The last thing is how straight or curly is the hair. With curlier hair can be a lot more forgiving because the hair kind of intertwines and crisscrosses, creates more coverage or the appearance of more coverage. And so that's another sort of important thing to think about with guys with straighter hair. Doesn't necessarily mean they are balding if they have a crown which resembles this. The most important question to ask with patients presenting like this is their age. If a patient under the age of 30 comes to me with this kind of crown, for me it suggests that they have undergone what we call the initial wave. Now this is something that I've seen in my practice. Patients will tend to experience a generalized loss of density throughout the entire top of the scalp compared to their teen years. The reason why we see this in the crown only is because the hairs coming out of the crown actually exit the scalp skin perpendicular to the scalp skin, meaning at a right angle or kind of directly straight out, if you like. Unlike the rest of the top of the scalp where the hairs come out and they kind of create what we call a layering effect, where they layer on top of each other and create an appearance of more density. And that's why when patients experience that initial wave, it is first seen in the crown. Because if you imagine when we look down on the crown, especially if the hair is straight, we'll be able to see, and especially also if there's downlighting, which will highlight all of the insufficiencies, or we will be able to see between those hairs coming out of the crown, and it will again create the illusion that the crown is the only place that is thinning, when in reality they've undergone what we call the initial wave and the whole top of the scalp has actually experienced some thinning. If you've experienced the initial wave and you're under the age of 30, does this mean you are balding? Well, really the only conclusion we can take from someone under the age of 30 who has experienced the initial wave is they are at least somewhat or slightly sensitive to DHT. Unlike some of our colleagues or friends who still have the same density and hairline as they did when they were 15, 16 years old. The initial wave does not suggest that you will lose all your hair by the age of 30, but it does suggest that hair loss may be a part of your life, at least to some degree, which is, by the way, more quote-unquote normal, since 80% of men by the age of 80 experience some degree of thinning. If the patient is over the age of 30 and they are showing me that their crown looks like this, and if they have experienced no other loss in the form of, say, recession or any kind of thinning behind the central forelock region, which would ideally require an examination, if they've just experienced that initial wave, this does suggest that they are not going to have advanced hair loss in the future. So there's your answer, guys. It mostly depends on your age, but really the only way to be 100% sure is through a consultation with an expert. Do shoot me an email, drparissis@gmail.com, if you want a reliable diagnosis of male pattern baldness and if you want to know your personalized treatment options for you.